The Democratic Republic of Congo is battling its deadliest Ebola outbreak on record, with the virus spreading at an unprecedented pace. Delayed detection, conflict and stretched healthcare resources are hampering efforts to contain the deadly outbreak. Here's a report.
It's a grim milestone. The current Ebola outbreak in the Democratic Republic of Congo is the deadliest in the country's history and the second most lethal on record. It's also spreading 5 times faster than previous outbreaks in Congo did at this stage, health officials say.
You're still running behind the epidemic. It's still very high, intense transmission.
How come the outbreak is so deadly and spreading so quickly? As a rare strain, the virus got a head start and spread undetected for months. Early cases of the Bundibugyo species were missed or misdiagnosed. Health workers at first relied on tests for the wrong Ebola type, and samples were mishandled. A July report in Science Journal concluded the outbreak began in January at the latest, but it wasn't declared until May. The virus is spreading faster than it is being tracked. About 80% of new infections emerge outside known transmission chains, according to the World Health Organization. Late detection means more people die. The fatality rate has risen from about 20% of cases in late June, which was probably an underestimate, to 47%, according to government data.
It could be reduced. It could be reduced if patients could come earlier, because the earlier people come, the more you can do for them.
Esther Sturck is Tropical Diseases Advisor for Médecins Sans Frontières.
It also shows that people have bad access to treatment centers for different reasons. So either if they're sick, there's no treatment center available, or they cannot reach it due to security issues, or it's too far away. And then they come, for example, in a very late state.
Aid cuts have led to funding and staffing shortfalls. Workers at an Ebola treatment centre demanded their unpaid salaries in July. "We are giving our all to look after our patients," this protester says. "Why can't the government support us?" It's dangerous work too, as this doctor's funeral shows. USAID was awarding a 5-year contract to carry out health surveillance in Congo when the agency was shut down in 2025. That's according to Tom van Boven, its global health security team lead. As of mid-July, the WHO had received less than half the funding needed to fight the Eastern Congo outbreak. The WHO's Tieno Balde.
Looking at the scale and also the geographic expansion of this outbreak, what all it requires, the distances, the need of cars, ambulances, and all of these elements, it's clearly, need more funding capacities.
The outbreak is concentrated in eastern Congo, where war has hampered access to communities, movement of personnel and supplies, and contact tracing. So have mistrust and disinformation. Hospitals and health teams have come under attack.
There's high need to engage with the community so that people understand what is the disease, they accept to come to the Ebola treatment centers.
Displacement from war may aid transmission. Dozens of deaths at this camp were suspected to be from Ebola. There is no licensed vaccine or proven treatment for the Bundibugyo strain. Most vaccines were developed for the more common Zaire species. But a small number of experimental vaccines and therapies are being evaluated, and global health authorities are assessing whether existing Ebola treatments offer protection.